This is Orsi, the old guy at oldguytalkstome.com, a podcast dedicated to helping older guys create kick-ass lives for themselves and those that they love. Join me regularly as I share my interviews with experts on various topics that include anti-aging, sex, relationships, and other things that will help you create that life that you want. Now, I want you to do three things. First of all, I want you to subscribe so you don't miss any of this life-changing information. 2, share it with others. And 3, review. Be sure to do all 3. And now for our podcast. Now, I want to make sure that you do 3 things. 1, subscribe so you don't miss any of these episodes. 2, share it with your friends because you know they need to hear this information also. To get this stuff so they can have a kick-ass life. And 3, review this podcast. And if you've got a bad review, that's fine too. This is Orsi, the official old guy at oldguytalkstome.com here, a podcast dedicated to helping older guys create kick-ass lives for themselves and those that they love. And part of that has to do with staying healthy and, well, trying to mitigate some of the effects of aging. And there's a lot of them to mitigate. And the older I get, the more mitigating I do. Even with all the stuff I do, I still have to do more mitigating. I can't imagine if I had to mitigate if I didn't do all the stuff that I do. But today, we're very, very honored to have Dr. William Seeds as our guest again. I would encourage you to watch the first podcast that we had, because we're going to get a little bit more granular this time on some stuff. But actually, we're going to be talking about cancer. We're going to be talking about the rules for peptide therapy. And we're also going to talk about, well, something a lot of fun, which many of you may not know, that, well, there are peptides that are aphrodisiacs. I guess I don't know if it'd be correct to say medical grade aphrodisiacs, but I'll do that. I'm sure Dr. Seeds will correct me if I'm incorrect. And that's no problem because the old guy's used to being corrected on a regular basis. So Dr. Seeds is a board certified orthopedic surgeon practicing medicine for over 25 years. He's founder and chairman of Seeds Scientific Research and Performance and Mastermind and founder of the International Peptide Society. He's faculty developer and lecturer for the A4M Peptide Certification Program and leading peptide therapy researcher. Dr. Seeds is also chief of surgery and orthopedic residency site director for the University Hospital, Geneva, Ohio. He's a professional medical consultant for the NFL, National Hockey League, Major League Baseball, NBA, and NBC's Dancing with the Stars, which we know is, if anybody's seen any real serious dancing, there's plenty of opportunity for people to get injured, especially when older people who are dancing there most of the time are not stretched out like they're supposed to be. And and he practices now. He's located. He's got a practice in Ohio and Beverly Hills. So welcome back on the program. I appreciate you coming back for a second round and go with the to talk with the old guy here.
It's always good to be with the old guy.
Oh, well, thank you. You get a debate on that from my wife, but needless to say, let's not get distracted here. Now, before we get into peptide therapy for cancers and also peptides as an aphrodisiac, there's a lot of things out there. There's a lot of people talking about peptides. You can order them in the back of a magazine. I know people don't order stuff from a magazine. You get them on the internet now. Nobody orders anything. I'm old enough to remember ordering stuff from the back of a magazine. Those little ads that they had, you could barely read. But what are the 3 rules for peptide therapy?
Well, so I think where people need to be focused, just as the physicians need to be focused in the prescription of these peptides, is number 1 is the quality of the peptide. You want to be assured that this is a peptide that has the potency that it's supposed to have, which is it's supposed to be 99.8 or 99.9% pure peptide, because that is very, very important in this peptide doing its job and appropriately sending the right messaging. And if that peptide is off by, say it's 96.5% pure, people would think, well, that's pretty good. And in our from our point of view, that's not good, because we don't know what that smaller percentage, that fragment, will break off, and we have no idea what that'll do in the body. And that's why it's so concerning when you see a lot of these pop-up internet sites that are selling peptides that are, they're all from outside of the country, and you don't know, well, we do know where they're made, and you don't, the problem with purity is out the door. And then you have problems with sterility, and you want to make sure that, you know, when you're buying these peptides, that they have that authenticity, and that they have been properly represented by that pharmacy where you're getting them, and they have their appropriate certificates, and they've been third-party inspected. And I mean, that's why there's costs behind those things, because you're getting something that's valid versus something you have no idea where it sits in that, from that perspective. The other thing is that we want to make sure that, so with that it represents that you're, you know, by working with a physician, you're utilizing the right peptides for the right problem. And too many times you get on these boards and you see what these people are writing and discussing, and they're so far removed from really what these peptides are valuable in doing, and in combinations, and how to use them. And it's very important that you understand that. And that's why you need then the proper protocol, which is the third aspect of the right protocol for the right issues, and trying to get through and mitigate a problem you're dealing with, or just improving your life from an aging perspective. You want to have those opportunities to work with people that have worked with the appropriate protocols to take care of people like that.
Yeah, I think those are things. And you have a service on your website, and we're going to put a link to that in the program notes, that provides a referral service to doctors who are trained specifically in what is the appropriate protocol to write peptides to use in very specific situations.
Yeah, it's the SSRP Health Mastery Program, and we're connected with doctors not just here in the United States, but all over the world, that are part of our organization, and we have the ability to connect patients everywhere, and that's what we've been doing. And it's really, that's a tremendous, I think that's our initiative and service that we owe to the public, to be able to get you to, you know, in the right direction for that.
Yeah, I think that that's actually an incredibly valuable service, because when you get on the internet to search for practitioners, it can be for actually for anything, but let's just stick in the medical field. Everyone's got a fantastic, fantastic website. I mean, you know, they're all like spectacular, you know, very dramatic, and and everybody's got their testimonials, and you're just kind of really, you're kind of like, gosh, you know, they're all so great. Which ones are really great? Which ones are not? And so I think that's a tremendous service that you are offering, that you're actually able to direct people that have been well trained in this particular area, because there's so many times that people are just, you know, it's a very, in some ways, because of because it's, you know, not a really insurance-based business, so people are kind of attracted to it from the financial sources. And I'm not, you know, everybody here wants to make money. We're all capitalists in one ways, but you want to provide a service. But a lot of times people get into it, they don't really know. They're just in it for the money factor versus providing the service that's actually very good in that area. Um, so let's talk a little bit about cancer, and this may really surprise a lot of people, because you know, a lot of times you think about peptides to deal with soft tissue injuries and things like that, hair growth, and other things, which one of them which we'll discuss later on. But what what is the status of peptide therapy and cancer therapy today in 2021?
Well, it's really leading the forefront in research, where the if we look at the if we look across the board at all the silos of medicine, oncology or cancer is leading the forefront in peptide research. And in fact, we just did a combined, we spent a day with the Lymphoma and Leukemia Society
Mhm.
and did an educational a day with them in, and this is on YouTube, and Karen can provide that link, where we discussed some of the latest initiatives in hematological cancers, in where these peptides are leading the way in changing the way that we're able to approach and treat cancers that by the way, when from cancer's aspect of how we work on cell efficiency and changing the cell to be more susceptible to chemotherapies and other immune therapies with some of these peptides, we are also able to translate that into other areas of care like diabetes and immune disease and aging. And so we're able to pull some of this current research into and translate it into ways that we can take advantage of helping everybody. And that's actually been something that's been a proven course with cancer, with other drugs and small molecules that have been used to treat problems that have been translated into other areas of medicine. So it's an amazing growing field of changes that we're seeing on a daily basis, and it was just tremendous to be involved with that. And we actually raised $50,000 for the Lymphoma Leukemia Society that day with all the doctors. I had about 12 of my fellows presenting, and it was a really great effort working with the society and just showing the relevance, because unfortunately you see all the some of the bad issues out there that shouldn't even be a topic of discussion out there and on the internet about things that are wrong with peptides, where people don't realize this is where the world is right now, and this is where the best research in the world is right now. That's happening with cell signaling and cell metabolism, in understanding how we can provide a better playing field for combining therapies in combination with peptides. And that's changing the world right now, and it's just fantastic to be in that space right now.
Yeah. One of the things you've talked about was the focus on the cell
Mhm.
in cancer therapy, and then I kind of want to have you talk a little bit about that, and also the strategy in terms of uh, explain to our audience what P53 is, and why that is such an important part of controlling cancers or stopping cancers.
Sure. Well, so P53 is a tumor suppressor gene that we all have. And we as humans, we make one P53, we have one P53 gene, as opposed to an elephant that has 25 P53 genes or more. And by the way, it's a rarity, if anything, that elephants develop cancer, because they've got so many um, uh, of these tumor suppressors, where we just have one of the P53s. So there's some interesting correlations when you look at that, and very similar in whales, something very similar also. So where P53 is like the master regulator of cell redox and cell cycling, and it really does, it pulls in the immune system, it controls what we call the proteasome ubiquitin system of controlling proteins, and so it knows how to work with environments that are changing, that can lead to potential cancer. So it has ways. That's why it's called um, that's why it is a regulator of it's a cancer gene to regulate cancer, and it turns on mechanisms to be able to try to control that. And so cancer can mutate that gene. 50% of all cancers are mutated p53 genes. And so that's a significant amount. So if we can do things to mitigate those changes that change that p53 and work in understanding, different ways that is affected, or we can work with controlling and making where p53 may not be involved as a mutation, but it can still be activated and used in controlling the cell cycle, well, we can work with it also. So those are the ways that we are very orchestrated in trying to work with p53 as a suppressor. And there's a lot of ways of doing that, and that's what's fabulous about it. It can work in autophagy. It can work in immunity, in making immune cells sense and see cancer cells, because typically cancer cells can camouflage themselves so that your immune system doesn't see them. But p53 can change that environment if it's influenced the right way, and the tumor cells can be recognized and gobbled up by the immune system, which is how it's supposed to work. So in general terms, that's kind of the value of that p53 tumor suppressor.
Okay. And do peptides enhance the p53 or protect it? Is it protective in some way, or how does that work?
Yeah, there are different type of peptides that can help that can regulate p53, that can keep it from being, so there are ways that the tumor cells have the ability to downregulate p53. So we can turn that around by controlling some of those mechanisms that do that. And we can, like I said, we can enhance p53's ability to work with immune system cells to enhance their ability to work against tumor cells. And those are just two generalities of going at it. There's many other ways of working with p53 to improve cellular redox of a cell, which has everything to do with how a cell makes its own antioxidants to work on dulling the inflammatory state of a cell. So there are multitudes of ways, and that's why there's so many studies going on focused on cancer, because there's so many mechanisms involved.
Mm-hmm. Yeah, that's it's unfortunately we just have one, and the elephants are way ahead of us on this one.
They got us on that, and it's contrary to, they're big animals. They've got many more cells dividing, so you would assume there'd be many more things going wrong, because it's all about a cell dividing, things going wrong. Well, they've got more ways of mitigating those problems and controlling them, and we have fewer. So that's kind of that issue.
Yeah, I figure all the elephants that had cancer died off a long time ago, and then they didn't propagate. So one of the things that I also was reading, that peptides can be used to basically control some of the wasting away effects of cancer.
Yes. So there have been a plethora of studies that have shown ways of, like, people that have gone through. So some of the issues of when people have cancer, it isn't the fact that the cancer kills them, it's the therapy kills them. It's the chemotherapeutics, the radiation therapy that can affect the bowels, can change the microbiome of the bowels. They can affect the way you absorb protein and carbohydrate, all those things that necessitate the cell to continue to be viable. And so there are peptides that we can use, that we can work with improving bowel function and protecting the bowel and protecting the cells, to improve the utilization of nutrients and proteins and carbohydrates and things that get better absorbed. Because a lot of problems it's called cachexia, where people lose muscle mass. And by losing muscle mass, you're automatically losing an amino acid pool that's very important to other cells functioning and propagating, because they get their amino acids from muscle. But if muscle can't continue to build, you're going to steal that. And so it has a lot to do with absorption of amino acids and things like that. But there are absolute ways to help in mitigating those problems, because that's where people get into trouble. And that is unfortunately it's not as focused on, because you're focused on killing that cancer, but yet by killing that cancer, you're setting up people for other problems, because you've also injured some of the good cells.
Mm-hmm.
And that's the problem. So by using some of these ways of working with improving absorption in the bowel or improving appetite in the brain,
Mm-hmm.
you're able to affect the uptake, and people wanting to eat, and people wanting to, because a lot of that is lost too, through signaling in the brain, because they lose that want or need for eating too. So there's approaches to the brain, and there's approaches to the bowel to work together to try to keep that nutritional status while they're going through chemo, and more so after chemo. The after chemo effects are just as important when you can bring people back.
You know, how how deep into the medical community, let's say in the oncology community of people that treat cancer and other things, how what is your success in terms of getting that kind of information into the hands of those kind of practitioners so that they utilize the full benefits of peptides as adjuncts or as primary in cancer therapy?
Well, it's growing significantly now. We have a lot of oncologists in our society that are keen to this information and realize how important they've used them to help their patients get through some of these states of, especially the cachexia things you're talking about here, but other ways of augmenting, their standard therapeutics and protecting cells. I mean, here's just just a simple thing like a nutritional supplement, like a ketone ester. A ketone ester is a nutritional supplement, not a peptide, but it's another molecular modulator of a nutritional supplement that can actually keep a cell healthy while it's being irradiated, meaning
Mm-hmm.
it can keep the good cells healthy, and it's been proven. So it's all these little things that are part of cell efficiency and metabolism that the oncologists are all on top of, and they are becoming more and more relevant in our society. And a lot of us work with teams of oncologists and physiatrists and nutritional specialists, and we all work together because we realize that we kind of bring a lot of things to the table together to help the patients. And what you're finding out now, I think this information has been so powerful that it's really been the patient demanding the cooperation of all of these people together. And it's the patients going out and finding the physicians that will work together. And I think you're seeing that that influence is undeniable and continuing to explode, because it does come down to the patient saying, hey, look, I want everything working my way, and I'm still the captain of the ship here. You're working with me to help me. So I want you working with this person, and I want you to tell me why. If you don't think so, tell me why you can't, because I'm the shopper here, and I'm going to put all the information together. And that's kind of interesting to see those dialogues. I can tell you years and years and years ago, it was a lot more difficult to work with more traditional oncologists and kind of introduce some things that they weren't familiar with. But that's changed. That's absolutely changed in the last 10 years. And especially because a lot of their research right now is on the forefront of their research is with peptides. So they get it now with this cell signaling, and they're an incredibly intelligent group of physicians that are, from my standpoint, have been very cooperative and wanting to further the health of their patient. And so that's what it all comes down to.
Yeah. Well, that's good to hear because a lot of times people get kind of stuck in their ways and don't really aren't really very accepting about new things or new ways of doing things because they've kind of learned how to do that and they don't want to move off that particular point of view. I know that in the old days when I used to be a periodontist, within the first 5 years of my of finishing my residency, I only did 10% of the procedures I learned in my residency. It was actually
Right.
amazing.
Right. I remember we had that discussion. You're so right. It's well, the problem is that I think that's where the patient has become more powerful too, in making
Yeah.
sure that isn't happening like it used to. And there's just too many. Here's the issue: there are too many good outcomes with this approach. So why wouldn't you want to be there? And why you don't want to be that person that isn't getting those outcomes? So
Yeah.
I think that's what it comes down to.
At the end of the day, as a practitioner, it's nice to see happy patients.
Right. 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 Right.
and and I'm sure and not to take it away from, but an oncology practice is not necessarily a happy place.
Yeah, and it's difficult. They have a tremendously difficult
Oh
job, and
yeah,
it's why
absolutely.
working. I'm telling you, it's why working as a team really makes a difference, because then there are more people that can address some of those things where where some people are a little more removed because they deal with so much of it that they have to separate themselves to a degree where you can have an influence of being more of a communicator and being part of that team to fill in for that and
Hmm. Yeah,
realize that they have those issues and limitations, you
yeah,
know.
yeah. Well, and yeah, I didn't mean to be disparaging. It was just more the when you're dealing with someone in where their life is at stake and they've heard the C word. It's everything. Everything changes when you hear that word.
Yeah,
Everything changes. All your priorities change. A lot of things go out the door. All of a sudden, your life is just not the way it was the seconds before you heard that word.
you're right. 100% right.
Yeah.
100%.
So I
The
was.
founder of SES Research and the creator of ESSC60, which is a powerful antioxidant. Now, this antioxidant was found to be beneficial by accident when laboratory mice that were given it lived twice as long as the ones that did not get it. That's right, 2 times as long. But other reports by people that have taken this powerful antioxidant talk about major benefits that they've seen in their lives. For me, I can speak about the benefits that I've had, and as well as my wife. We've noticed, one, that our focus was significantly improved, and we were able to get more done because we were sharp. Secondly, our energy levels were higher. And those energy levels lasted late into the afternoon when you kind of have that dip in energy, start going a little foggy, not quite so clear, you're tired. Well, our energy levels were really high way into the afternoon. And for me, I slept better. I am a fitful sleeper. I'm a horrible sleeper, and I crave a good night's sleep. And I started to sleep better when I had C60. Now, you may have different results, but I want to tell you, it's worth a try. Now, Chris and his company are the major producers, the major manufacturers of C60. And most people who sell C60 on the market buy it from them and put it into their own formulations. But why would you do that? Why would you buy it somewhere else? When you can get high grade, high quality, highly tested C60 directly from the source. So what are you going to do? Click on the link below, order a trial, try it for a month. Use the promo code OldGuyTalks, one word, OldGuyTalks, and get $15 off your initial purchase. What do you have to lose? I think you have a lot to gain. Try it. Don't wait, don't hesitate, don't procrastinate. Get your C60 now. It may make a world of difference to you in the quality of your life. It did for us. Don't wait, don't hesitate, don't procrastinate. Do it now.
So I want to switch gears to something a little bit lighter.
Absolutely.
Yeah, a little bit of a schizophrenic program here today. So we briefly touched upon this in the last program, and peptides are. Let's see, how should I describe this? Peptides for fun. Uh, so tell me about these. Is it multiple peptides or one in particular that is a aphrodisiac? Basically, a medical grade aphrodisiac that's out there.
It's basically, I think we're talking about one peptide called PT141 or brematolamide, and it's a peptide sequence that has been, it's a smaller fragment of melanotan 2, which is an alpha melanocyte stimulating hormone, and it is something that's been heavily researched and it's an FDA approved mechanism of working not just on the male side but also on the female side of improving sexual arousal and performance. And that has been the kind of the barrier where like the Cialises and the Viagras on the female side haven't really been that effective in working from the executive side, the cerebral side of this, where more of this is when we talk about the melanocortin system and where this PT141 is working with the melanocortin 4, it has everything to do with central control of libido and sexual arousal that leads to the vasodilatation of the penis and of the clitoris and the and all those great things that happen with that from the brain. And that's where the breakthrough is in finally being able to do something on the female side, and that's where the original research all started, and that's significant in being able to change that playing field now. And as far as from a practitioner standpoint, to be able to have that now and offer that and work with problems, dysfunction for females is tremendous to have that available now, that is effective and can change the life of where unfortunately a significant amount of females have problems with sexual arousal, and this changes the playing field there, and just as effective for males. So it's been and the delivery systems have been changing to where, you know, we started with injectable and now we're getting better with our intranasal use of this peptide. So it's really come a long way with its ability, the ability to make this and provide it for the population around.
Yeah. So I imagine this is not something that like a guy wants to do on his own uh, without a consenting partner. Is that correct?
Unless he's happy to be by himself, you know, correct. You want to have your partner available, and that, you know, that's the interesting part of how this works. It tends to be the PT141 for females, for the most part, once they take it, they can have within an hour or two, sometimes less than that, they can be ready to go. From the male side, it's a little more, it can be a little more variable. It can be up to 4 to 6 hours before they're at a plateau. And some though can be ready within an hour or so too. So you kind of have to find the right area for both partners. And that's, you know, that's part of working with your patients and determining that.
Okay, I just have this picture of some guy there who's in the 4 to 6 hour category, but after an hour, he's just putting stuff up his nose some more. I just
That would be that that would be the wrong thing to do, because then he may be going even longer than he wants to go.
Yeah, I just, I just, you know, sometimes guys are just stupid. I mean, let's just admit it. And sometimes I could just see that happening so easily. Like, oh, this stuff is not working, and next
Oh,
thing you know,
you're not far off. We've got all those stories, that's for sure. And the, you know, for the most part, the good thing is that it's a relatively safe peptide from that standpoint, that rarely do they get in problems with priapism, where you can get into issues with Cialis um, uh, or Viagra, and those can be emergency room kind of situations. So from that standpoint, it's a pretty good way of working with it. You don't want to combine them. That is something that people mostly advise against, especially in males, of trying to combine Cialis or um, Viagra with PT-141.
mhm. Typically, how long is that? What's the duration? Is it hours? Is it days? Or
For sexual arousal, it can be a couple of days. Yeah, and it can be it definitely, for a female, it can be up to 3 days, and for the male, it's typically a couple of days of feeling like you're ready to go. And there's initial ready to go, and then you're able to kind of repeat and perform for a good 48 hours or so. Yeah. So
yeah,
it's a as you said, it is referred to as a recreational peptide
yeah,
um, for weekends and vacations. Very popular on vacations.
yeah,
And yeah, so we've
yeah.
had a lot of great success with it, and I have to just say that part for the females has been just a game changer, to be able to offer something that
Sure.
we didn't have before, and that's tremendous.
And you know, I mean, we laugh about this, but that also has been a great source of frustration in many relationships, causing a lot of tension. And so it's nice that there is that this is out there to alleviate that.
It can completely change it, and that's where and that the females that didn't realize that that was available, or didn't realize that it was something that made sense to them, about signaling, and that they could change it. And in fact, the studies haven't come out yet, but there are people actually doing trials now and working on if you do this. We don't recommend doing this more than twice a week, or maximum 3 times a week, because you can downregulate the receptors of where it won't be as effective.
Hmm.
But where there are people out there that are looking at studies right now of trying to see if you can entrain this process by using lower dose over so many periods a week, and where people can stay consistent and have uh,
Hmm.
that that are severely affected by loss of libido and so forth. Um,
Yeah, I'm sure that there will be a lot of people rewinding and playing this segment back from the beginning.
it's one of our most popular peptides, and it's it's one of those. Like I said, it's uh, it's been tremendous in changing that, and it's interesting too, because there's other things that we're just it's so much more than just the physiologic change.
Hmm.
It's the mental change, and um, the desire, and all those things that come with it, and I think that changes the experience.
Hmm. Okay. Well, that yeah puts you in a whole different state, which is because it works on your central nervous system, which is a pretty incredible thing. Um, I want to again switch gears here. It's something that we had talked about in the past about growing back soft tissue, because you told me some stuff in the first time we spoke that really just kind of blew my mind, because was familiar with regenerative products and therapies from surgeries, but you got some stuff that's really just incredible. Tell us about peptides and regrowing soft tissues.
Well, it's so more so in we're looking at eh, we're looking at that aspect of cartilage regrowth and in the joint because of the significant problem that leads to with degenerative arthritis and loss of function, and it affects so many people around the world. Well, we're able to now have these hydrogels that act as scaffolding to hold some of these peptides in a space of where we're trying to change the cellular type of the cartilage. And we have the ability now because that cartilage typically becomes a fibrocartilage. In the past, it changes to a fibrocartilage that isn't advantageous over the long run of reproducing joint function. But now we've proven that we can change that type 1 cartilage to type 2 cartilage, which is the type of cartilage that we want to continue to maintain a healthy joint. And that can be done with a couple of peptides that are FDA approved to use together in a scaffolding. And there are other ones, there are a plethora of other peptides that are just as effective that haven't reached that level of FDA approval. But there are many coming down the pike, I believe, because we're just at the beginning now of doing some amazing things in controlling the loss of cartilage and the rebuilding of cartilage, because now we can hold those peptides in a particular place. And it's just the problem right now is the expense with it. But with all things that will change. And these hydrogels will change. And the peptides will get even better. But I think it's a fantastic place to be in right now, where we have some things that are changing what we can do in a joint.
Yeah. I think that's just absolutely amazing. And when do you think now these are procedures that you're doing now, I suspect in clinical trials, is that correct?
Yeah, so all of that right now it's not a thing. It's not being used across the board in the public population. We are using HAAOD with a hyaluronic acid to treat arthritis. And
what's HAAOD?
So AOD is a peptide that is a repair peptide. It's a fragment of growth hormone, and it's a smaller fragment that works on repair and controlling of inflammation in a joint, and controlling senescence, which is really the problem in a joint. And that hyaluronic acid will hold that AOD, that peptide, in the joint and hold it there so it can do its work. Now, in animal studies, it's shown to change the cartilage, just like I was talking about before with the hydrogels and the BMPs and avastatins and so forth. These HAOD has done that in animal studies. We just haven't proven that in human studies to date, but we've shown that we can improve the inflammatory status of a joint, and we can actually treat that joint better than what's out there in the current market with hyaluronic acids that are being used right now. So that's a huge step in being able to show that you can improve the inflammatory state of a degenerative knee. And and in practice, we're using that. And that has been one of a big effector for me in my practice, of where I can keep a lot of people from joint replacements and other surgeries, meniscal surgeries or cartilage surgeries, where I'm very effective in utilizing something like that, or combining a neuropeptide with that. So these neuropeptides have been proven to show that they have a way of working in the cell signaling in the knee or the shoulder or the elbow or the hip. And so we've done some amazing things with combining some of these to really change the way, at least I do, change my orthopedic practice and how aggressive I am with surgical procedures.
Mhm. Now, the placement, is this a microscopic surgical procedure? Or is it, or is it,
The scaffolding and so forth, the research stuff is yes, but the clinical things we're doing right now are basically injectable with ultrasound.
okay.
And that can be done in the office setting.
Mhm. Okay. Well, if somebody wanted to uh, find out more about this or possibly work with you, where would they reach out to you?
Through the SSRP, through,
Mhm.
and I think Karen will has that site, and that's how, it's not just me. We have a lot of physicians that are working with this and working with stem cells,
Mhm.
which is a whole nother avenue of preparing the stem cells appropriately for the joint. And so we've got a tremendous group of people, I think, that other people have the advantage of working with or understanding where they're at in their in trying to help people with what they're working with.
Okay. Well, we'll definitely have those links in the program notes for everybody to be able to find and make use of as a resource. So I want to thank you for coming back on board again. This has been just absolutely fascinating. We were able to get into more depth on some of the particular areas. The last time we spoke was kind of a more general overview, but it is exciting. It's exciting to see what's going on, and the future is just so bright. There's so many things that are available now that weren't available just you know 2 years ago, 4 years ago, 5 years ago. This was just you know pie in the sky dreams that didn't exist. So I think it must be very exciting for you to be practicing at this time.
Well, like you said, it's wonderful to see the outcomes where before I may not have had an influence like I do now. And it's why I went into medicine. I've waited 25 years to get to a point now of why I originally went into medicine, to be able to do the things I can do now that are tremendously satisfying, um, where you can mitigate a lot of risks. And not to say, some of the things I think we do as orthopedists, because we are pretty sure of ourselves as in what we do. Um,
No.
um, we do a great job surgically, and I think it's why we're so attracted to it, because of the instant gratification we get from a lot of things we do for our patients. But saying that, I will tell you that, like I said, my practice has changed tremendously now with what I can do on the molecular side of the cell, and how I can influence the cell to do so many things that I couldn't do before. And that's a privilege to be able to be at that point where you can help people. And I know that's going to change. It's going to change orthopedics, and it's already changing what we're doing in disease states, in infection, and in autoimmune disease, in cardiac disease, and pulmonary disease. I mean, it's across the board, and it's just so exciting to be in this area right now. And on top of that, to be able to help people as they get older. Everybody's so focused. I don't know if we talked about this before, but everybody's focused on, I want to live longer. And I'm like, what the hell are you talking about? It's like, it's all about living what your genes are programmed to do to get you to a point. And I'm all about getting you healthy all the way till that point, meaning, you still have your golden years. You still can be viable. You still can do the things you did when you were younger. Isn't that what, you're fulfilling your life? I don't, can we improve lifespan? Maybe a little bit. Maybe that comes with it, but nobody knows that for sure yet. But I do know I can improve life during that later span. And I think that's incredible.
Yeah. The whole point of old guy talks is not to just be alive, but to live life.
Yes, right. You know how many times, that's a great statement, because that was one of the most frustrating things early on in my orthopedic career, where all the people coming in that would say, Doc, I've worked so hard to save this money and retire, and now I'm screwed because my golden, what are those golden years everybody's working towards? It's not there because I can't do it. I'm here to see you to help me get to that point, but it looks like I'm going to need this operation, then I got to need this. It's like, it's so frustrating when I knew there were ways that we could get around some of these issues, and now I'm finally doing it. So it's really exciting.
Yeah, absolutely. Well, I'm glad you're at the forefront and a leader in this space because you've obviously are providing lots of guidance and leadership to other practitioners and maintaining the integrity of the peptide space, because that certainly is something that has suffered in the past. So I commend you and thank you for taking the leadership role here in this space. So.
Sure.
Once again, thank you for coming on the program and having this conversation. And the contact points will be in the program notes. Thank you, Dr. Seeds. This is Oris, the official old guy, because he's got a government Medicare card. He's official old guy at oldguytalks.com, a podcast dedicated to helping older guys create kick-ass lives for themselves and those that they love. Check out the Peptides and Dr. Seeds website.
Now, I want to make sure that you do 3 things. 1, subscribe so you don't miss any of these episodes. 2, share it with your friends, because they need to hear this information also, to get this stuff so they can have a kick-ass life. And 3, review this podcast. And if you've got a bad review, that's fine too. Thanks for listening, and be sure to subscribe, share, and review. Until next time, remember, it's all about creating a kick-ass life for yourself and those that you love.